Hi, I'm Dr. Bruce Van Natta. I'd like to talk to you about a procedure that's been in the news media quite a bit in the last few months called awake breast augmentation. Now, this is a procedure I actually had to look up as an experienced breast surgeon to find out about it. Of course, I went to the internet. What I found there was that the first half a dozen or so doctors that I looked up turned out to be OBGYNs. And the reality is, board certified plastic surgeons, that is by the American Board of Plastic Surgery, don't seem to be offering this procedure. This is something that's being offered by, what I like to refer to as the plastic surgery wannabes, in many cases OBGYNs, who have attended a weekend course, yes, that's a weekend course, to learn about this procedure. Now, what's involved, apparently, is that the breast augmentation is done in an office setting under local anesthesia. And this is touted as making it less expensive because you're not paying for the operating room or for an anesthesiologist. But I'll tell you, I have multiple concerns about this procedure. First and foremost is patient safety. And from a safety perspective, here you're having an operation that's being done in an office setting by someone who is really not an experienced surgeon in the first place, at least in terms of breast surgery. And what happens, the patient's under sedation, what happens if there's a complication? The patient's moving around, you get into bleeding. I can just envision a lot of problems that could arise. Also, I am bothered by the fact that this fosters this notion of if you can wish it or want it, you can have it in terms of breast augmentation. Breast augmentation is the most common cosmetic surgery done in the United States, and yet it has the highest complication reoperation rate, and that's by board-certified plastic surgeons. So it really makes you wonder what the complication rate is going to be with this procedure. I'll tell you, as a very experienced surgeon, I wouldn't try doing this in the office, and my recommendation to you is to find a surgeon who is board certified by the American Board of Plastic Surgery and talk realistically about goals, but recognize that your tissues may not be able to support as large an implant as you would like. And rather than trying to be the one picking the size of the implant under an awake augmentation, maybe work together with your surgeon to pick the right size for you. For the Plastic Surgery Channel, I'm Dr. Bruce Van Natta.